Associate Director of the Health and Wellbeing Program with the WorkWell Center and your host for today. Welcome to the Navigating Challenging Times webinar series, sponsored by the WorkWell Center, part of Office of Behavioral Health in Health Affairs. Navigating Challenging Times webinar series supports our USC faculty and staff to navigate through these periods of uncertainty with greater confidence. This series provides practical strategies, insights for managing stress and fostering resilience, as well as ways to prioritize our self-care, develop healthy coping strategies, and create sustainable routines that we can carry forward. We're glad to have you all here to join us to reflect, reconnect, and restore. These webinars are being held the third Wednesday of every month from 12 to 1 through December, and we hope you'll join us for the rest of the series. Today's topic is mental health and well-being support and resources for thriving. Mental health is a vital part of overall well-being and important during times of change and uncertainty. Today's session will provide an overview of the mental health and well-being resources available to USC faculty and staff. Discover a range of support services, programs, and practical tools to help you thrive professionally and personally. Before we begin, just a reminder to feel free to send comments or questions through the chat or the Q&A, and we will address a few at the end depending on time. And with that, I will introduce our presenters. It is my pleasure to introduce the following presenters for today. And thank you, partners, for being here. We have David Wu, Financial Reporting and Project Analyst from USC Health Plans. Cindy Ryan, Associate Director, Clinical Services with the WorkWell Center. Dara Marino, Program Director, Care for the Caregiver. Ebony Watson, Employee Assistance Professional with the WorkWell Center. Jennifer Barrell, Senior Workforce Health Consulting with Kaiser Permanente. Scott Waite, Senior Customer Success Manager with Lyra Health. And myself, Julie Chabdi, Associate Director, Health and Wellbeing with the WorkWell Center. And before we begin, just a reminder that anytime during today's session, you're welcome to stand, stretch, move your body in any manner that feels best for you. And with that, I will turn it over to Ebony and Cindy to kick us off.
Thank you so much. We're really honored and glad to be here. And here I'll introduce Ebony for our services.
Hello, good morning. My name is Ebony Watson, and I'm an employee assistance professional here at the WorkWell Center and also a licensed clinical social worker. The WorkWell Center has provided confidential counseling services to children, faculty, and staff for over 40 years. So I just want to share a few of the offerings that we have here at the WorkWell Center. We have the Health and Wellbeing Program that connects you to benefits and wellness services across campus. This team is designed and delivers webinars, wellness challenges, and health promotion programs, and includes our comprehensive strategic initiative, USC Healthy Campus. We also provide confidential, solution-focused, brief counseling to help employees identify and resolve personal concerns that affect work engagement and performance. And we also support you through navigating healthy plan benefits for long-term counseling. In addition, we offer executive coaching for directors, faculty, and physicians to help you succeed in your leadership roles, which are offered by certified coaches at the WorkWell Center through the International Coaching Federation. We also provide consulting services that are constructive conversations to help leaders support, empower, and manage their teams. We also design and deliver talks for groups on various mental health and wellness topics, and we support individuals and groups after high-impact events to manage stress and other reactions, enabling people to return to their daily routine more quickly. So who do we service? That's a great question. We service faculty, postdocs who are USC benefit employees, and we also service retirees. Our services are free, and we offer sessions via Zoom or in person. We have 2 locations. We have a location at the Health Science campus and the UPC campus if you're in need of services. So we are a hub of mental health resources where we want to support you in all of your domains of your health and well-being. So I want to end before I pass it over to Dr. Ryan to invite you to a special offering that the Workwell is having called Rest with Music, where the Workwell is partnering with key partners. If you have more information about our services or the health plans that we're going to mention today, you can come out to Rest with Music on October 2nd. Thank you. And I'll pass it over to Dr. Ryan.
Thank you, Ebony. We're looking forward, definitely. So in addition, we want to let you know that as well as we are an embedded program, we have an additional benefit through TELUS Health. It was formerly LifeWorks, but now it has changed, and the TELUS program is available again to all those who are benefit eligible. And it provides a wide range of counselors and mental health coaches. It just opens up so many options for language diversity and provider characteristics and expertise. And so it's a way we've enhanced the access to mental health services. It's very easy to access 24/7. And so you have numbers here and the webpage by which you might go ahead and find out more of the free confidential services that are provided through TELUS Health. And so just to give a framework for what we are about, the reason that we began to think about this workshop came from the mental health subcommittee of the Wellbeing Advisory Board. So it really offered a mission for us to look at how do we want to increase awareness, knowledge, sensitivity about mental health issues? How do we stay fully educated and resourced in knowing how and what we can turn to in a time of need, not only for ourselves, but for our colleagues and our families? So our goals there were to provide a way to destigmatize the mental health issues, make it easy, accessible, open up a way of supporting one another, especially during times of change. These projects were including resource lists internally for USC as well as external resources and self-help. A guide has been created, and as you see, these links are available for you to go right into the webpage and see what other resources. The more we know, the more we can share and support one another in our community. So thanks so much, and we'll hand it back to Julie for our next round of speakers.
Thank you so much, Cindy and Ebony, for sharing all of the great Workwell Center services and partner services that we have here. It is now my pleasure to introduce David Wu, who'll give us an overview of the health plans and also our 2 speakers from Lyra and Kaiser. David?
Thank you for the introduction, Julie. Hello, my name is David Wu, and I work at the health plans. Right now, benefit employees have several well-being resources available to those enrolled in the EPO, PPO, Kaiser, or Anthem HMO plans. And those on the EPO and PPO plan have access to Lyra Health, which offers free 25 sessions. You also have access to telehealth through Live Health Online and other providers in the network. Kaiser members also have access to wellness coaches, a self-care app, and support classes or groups. These flyers can be found on the employee website. Lastly, Anthem HMO members have access to Live Health Online and emotional well-being resources, which is administered by Learn to Live. More information of these Learn to Live can also be found on the employee website. With all these changes coming up that you guys all know, in the medical plans, more partnerships and providers will be added for 2026. Now I'll turn it to Scott for more information on Lyra.
Perfect. Thank you, David. I appreciate that. And I appreciate the time to come in and speak to you all today about Lyra, about the benefit that's currently in place for those members that are enrolled in the PPO and the EPO plans. So on the next slide, just a quick introduction about Lyra. and what Lyra was founded on, on that core belief that everyone deserves access to affordable and high quality mental health care. We've solved for one of the biggest challenges in the industry, and that's access, access to quality care, but also the outcomes of that quality care. And our mission is to really provide that life-changing health mental care for all members. And on the next slide, just kind of highlighting what that means when it comes to that instant access and the high quality care. Through Lyra, we have that access to some of the highest quality providers, and it provides members to get that access to those providers, typically within a day or two, meeting with them virtually, and up to 2 to 3 days meeting with them in person. So we combine that highest quality provider network along with our AI-powered matcher designed to really help deliver those outcomes. So when you're searching for care and utilizing Lyra, we provide those provider preferences so that you can find a provider that best suits your need based on the specialty of care you're looking for, the type of provider you're looking for, or even just their experience, their background, whether it's gender, whether that's someone experienced working with veterans. We have those provider preferences in place to help you get connected with that provider and start that process of working through something as personal as mental health care, working with Lyra. And that fast access to care that I mentioned is really crucial for that timely intervention, treatment, and the prevention of conditions worsening and becoming more expensive to treat outside of what Lyra can provide. Next slide, please. Just providing what that care spectrum looks like. You can see we provide this comprehensive care options from things like self-care, where you can utilize all of the resources available within the Lyra.com website that you're able to access to, or through the app. You have access to all of these self-care resources that are available unlimited. We also have coaching through therapy, where self-guided coaching allows you to work with a coach and develop a curated plan to help you get better with some of those more mild to moderate symptoms. We have coaching, as you can see, we have therapy, we can help with medication management, and then we can also help along with those specialty cares and some of those more complex issues around things like substance abuse, or maybe someone dealing with self-harm thoughts where they really need to get that higher level of care. So we can provide this broad spectrum of care through different modalities, whether that's virtually over a Zoom call, whether that's over the phone, or whether that's even in person with our providers. We provide all of that available to you as a member with Lyra. And now, as I talked about on the next slide about the provider preferences, I want to just kind of highlight what those look like here, and you can see some of the options that you have available here. So you come in and you're going to meet with Lyra and talk about, again, something so personal as mental health care. The first thing you want to do is meet with someone that you feel like you can connect with, whether that's someone with a cultural background, maybe a specific gender, or maybe, as I mentioned, someone that specializes in treating and working with someone that's a veteran. We have these options available to you to help you find the right provider and connect with them from the start. And what we have found overall is having these provider preferences. On average, we see 97% of members stay with that first provider following their first session with Lyra and continue working with them beyond that initial session. So now I kind of want to jump into the next slide and start talking about the member experience and highlight who can utilize Lyra. And I want to go back to what David mentioned on that first slide, right? About this is really focusing around the USC employees and your family members that are enrolled in the USC PPO or the Trojan Care EPO plans. You have access to up to 25 sessions per family member per year working with Lyra. And again, I want to call that out as per family member. So it's not for the entire family. If it's yourself as an employee, you have a spouse and you have two children, each of you have access to those 25 sessions individually working with Lyra to help you work through anything that you may be experiencing throughout the year. For those that and those sessions, again, those 25 sessions are free. So those are not any cost share out of pocket. You don't have to pay anything out of pocket for those 25 sessions. However, if you are looking for something that involves medication management, or you are working on sessions beyond those 25, you can continue to work with Lyra and our providers. And then at this point, it would go through the health plan integration, and it would you would experience maybe an out-of-pocket expense regarding your copay, deductible, coinsurance, depending on the plan you're enrolled in, whether it's a PPO or that EPO plan that we talked about here. And the benefit specifically that would be involved here would be the in-network outpatient mental health benefit. And that would allow you to identify what that cost would look like for you around the medication management or those sessions beyond the free 25 that I had mentioned here earlier. Now, within the platform, on this next slide here, I want to highlight some of those self-care items that I mentioned on that spectrum of care slide. These are all resources available to you at an unlimited resource, and you can access these through the Lyra library within the Lyra platform. So when you log into the platform, you can navigate to the header at the top that says library, and you'll see a toggle that says either for me or for work. So the For Me library includes content that really helps you personally build skills that support your mental and emotional well-being in your personal and day-to-day life. And we recognize that not everyone learns the same way. So we offer materials in a variety of formats, such as meditations, breathing exercises, articles, videos, and even soundscapes. And this library can be used at any time. And again, those resources are available to use, whether it's through the platform or through the app, and they're available on an unlimited basis. Now, on the next slide, I want to highlight the For Work Hub. And this is really that one-stop shop for content that is work-related and helps build knowledge and skills around well-being topics related to the life at work. This really includes expert-led on-demand courses on topics ranging from workplace skills, leadership to thriving at work, and culture and identity. So the topics here are really, again, to help you deal with things that are maybe keeping you from being at your best while performing at work, right? So the combination of the For Life and the For Work just helps bring it all together and helps you be at your best, whether it's at home with your family or it's at work with your colleagues. And that's what Lyra is here to help support with through this Lyra library. And again, all of the resources that are available here are available at an unlimited basis. Now, as we shift gears and we start talking about what's available when it comes to getting into care, this really focuses on two different modalities. The first of which is coaching. And mental health coaching is delivered by accredited coaches who practice evidence-based care and are supervised by our Lyra clinical team. When you go through coaching, you typically get this as a, this will present itself as an option for those that are dealing with more mild to moderate issues, right? As you go through that initial assessment through the program and through the platform, you'll answer some questions about what's driving you to care, what you're dealing with on a day-to-day life, and what level your symptoms are. And if you're more mild to moderate, more times than not, you would probably get recommended the coaching option working with Lyra. And you can see some of those symptoms or some of those issues that you may be experiencing at the bottom half of the slide that would drive you towards coaching. Now, coaching is available on a virtual level, so you can work with your Lyra coach virtually as you work through this. But if we shift to the next slide, we start talking about therapy. And the one thing about therapy in working with Lyra is this is available either virtually or in person. So we do provide that option to have, you have the ability to meet with a Lyra provider in person and meet with them that way. And where we see this happen a lot or maybe is asked for a lot is for those that maybe have children and they are looking for, child therapy help. Coming in person maybe makes it a lot easier to work with the child than trying to keep their attention virtually as you speak with them that way. So having that option of in person or virtual, I think is a great option here for therapy. Therapy really is for dealing with those more moderate to severe issues, like some of those you see on the bottom half of this slide. And we know that choosing the right care and the right provider can be hard. So we really try to make it as easy as possible when it comes to providing you and recommending you with the right level of care mixed with that right level of provider. Regardless of what you're coming to Lyra in search of, we're going to direct you to not only the right level of care, but to providers who are specialized in the areas that you're seeking support in. And our providers really work with each member to define their goals, focus on a skills building approach that matches their goals. And then this approach helps members achieve those long-term outcomes, so they can get better and graduate from care and not feel like they're stuck in an endless cycle of perpetual therapy. And that's what Lyra is really here to help with, is help you get better faster, but apply skills that allow you to keep that long-term mental health as you move forward. So my final slide here is just a reminder of the URL to go out and access Lyra, which is usc.lyrahealth.com. The phone number you see here on the slide is available for you to reach out to our Care Navigator team, who is available 24/7. And you can reach out to them for any questions you may have. And then the QR code here is to download the Lyra app, and you can go out and register there on the Lyra app platform. So with that, I just want to say thank you for the time. I appreciate you having me here today. With that, I'm not sure who the next speaker is, so I apologize, but we'll pass it on forward.
Thank you, Scott. Jennifer from Kaiser is next.
Yeah, thank you, Scott. Thank you, everyone. Such great, oops, it looks like I might be frozen. Okay. Such great resources that have been shared before. So again, I want to thank you all for inviting me today to join this really important conversation. So I'm specifically going to talk about how Kaiser Permanente can support those of you who are Kaiser Permanente members and your families. So I wanted to start off, next slide, please. Thank you so much. By reminding you that Kaiser really provides comprehensive mental health and addiction care services for adults, teenagers, and children. And wherever members and their families begin their journey, you'll really find access to a wide variety of tailored support. And as you can see here on the circle to the right, there's a spectrum, a large spectrum of ways that we support our members when it comes to mental health and addiction. And one thing that I really want to share is you do not need a referral to access mental health services at Kaiser Permanente. So you don't need to go see your primary care physician. You can, just call our behavioral health, there's basically no wrong door. So you can enter mental health support anyway, and we have a lot of different ways to support you. So next slide, please. Thank you so much. So as you may know, if you're a Kaiser member, you have access to two really great apps. You've probably heard of them before, even if you're not a Kaiser member, but these are available to our members at no cost. And Calm is awesome. I use Calm all the time. I love it. It is a leading app for meditation and sleep, and it's really designed to help reduce stress and support emotional well-being. Calm offers daily mindfulness themes, guided meditations, sleep stories with celebrities. I personally like the sleep stories read by Matthew McConaughey, and they also have sleep stories for kids. They also have some great video lessons on movement and stretching. So if you're a Kaiser member and you haven't downloaded the Calm app yet, you can go to kp.org/selfcare apps and select Get Calm. And then basically you sign on with your kp.org credentials, and then you get, the premium version of the Calm app at no cost. In addition to the Calm app, we also offer our members who are 18 or older Headspace, and Headspace offers a comprehensive library of meditation, sleep casts, music, movement exercises, and then 90 days of text-based emotional support coaching. So you're able to work with an emotional support coach directly via text message for 90 days at a time. So lots of great ways to, to support you and your family through Calm and Headspace. Next slide, please. All right, I also wanted to mention mental health education. So lots of ways, as I mentioned, to engage with Kaiser. We offer a variety of programs, classes, and workshops led by therapists and instructors, and those include in-person and virtual classes on a wide variety of topics, support groups, wellness coaching by phone. And if you'd like to check the offerings that are available in your area, you can go to kp.org/classes. You can put in your zip code and you will be able to find, the classes, programs, and groups that you can engage with. Again, we have in-person and virtual offerings. All right, next slide, please. Thank you so much. So we also offer a range of support and treatment for mental health, including outpatient services. So this could look like individual one-on-one therapy sessions, more of those group sessions, or one-on-one sessions with a psychiatrist. So, a variety of ways that we can help support you and your family. Next slide, please. Thank you. For our members needing higher levels of care beyond outpatient care, we do have these, as you can see on the screen. So those can include partial hospitalization, residential treatment programs, and those types of care for members that are struggling with mental health and addiction. So again, just highlighting that we have services, really to support our members across the spectrum of needs when it comes to mental health. Next slide. And you're probably wondering, how do I access all of these different ways of support and care? So on this slide, we have some phone numbers, websites, so that you can connect with Kaiser directly if you're experiencing, emotional distress, a mental health issue, or addiction. So, I believe Julie's going to be sharing all of these slides, so you have these phone numbers. But just really the take home message is that we are here to support you not only with your physical health, but also with your mental health, because we know that is really a key part of your total health and well-being. So if you have any questions, please put them into the chat. All of us presenters can see the chat. So we appreciate it. And thank you so much for inviting me.
Thank you, Jennifer. Great resources. And now I will introduce Dara from Care for the Caregiver.
Thanks, Julie. Hi, everyone. Nice to meet all of you. Our Care for the Caregiver team really is focused on our healthcare environment, particularly those at Keck Medicine. And why do we exist? If you're familiar with healthcare, these stats are probably not surprising. If you're more on our university side or kind of the research CASEM side, this might be new information, but we're looking at about half of healthcare workers, specifically even our physicians, that are feeling burned out. It spiked, of course, during the pandemic, but it really hasn't decreased as much as we might have hoped kind of in this post-pandemic world. And why is it that we care about it? It's because our stressed healthcare workers are, they're making medical errors, they're making mistakes, they're leaving the profession, they're creating these challenges with one another, and it's creating really discord at work. And so our Care for the Caregiver team was established. It started as kind of a grassroots effort in 2020, and then it became an official office in 2021, really with that focus that if we can support our healthcare workers, that will improve patient safety, patient outcome. So really bringing your best self to work is going to have a positive impact for the environment, for all of our healthcare workers, and ultimately improve our outcomes for patients. So next slide. And what has our approach been? There's no silver bullet that's going to kind of support everyone in the health system. Our healthcare workers have very different needs, even within the same team. There might be some individuals who have, financial struggles, whereas other individuals really need to take advantage of emotional support offerings. And so that's why, since the beginning, it's really been a multi-level approach. How can we provide a number of initiatives that really support well-being? And so we're looking at things such as skill building, mindfulness and wellness, physical relaxation, and then understanding that we can give tools and we can support the individual. And at the same time, there are system level changes that need to occur to really foster positive work environments and success, really, for each of our caregivers. And I'll just clarify, when we say caregivers for our Care for the Caregiver team, that means every single person employed in our health system. So it is ranging from our physicians, our nurse practitioners, to our administrative assistants, to our MAs. Really, everybody in the health system is considered a caregiver under our umbrella. And then as you thoughtfully apply these interventions, that's going to have more of an effect for our health system. And when we switch to the next slide, I'll show you really how we've adopted that multi-level approach. There's a lot of text on this slide, but if you take away one thing from this conversation, it's that we really look at the individual level, the system level, and the team level of how to provide support. So we have things like a phone line that any of our healthcare workers can call to speak with one of our counselors. It is Monday through Friday, 8 to 5, but we are relatively quick. And so if you call at 6 p.m., we'll call you back the next workday. And again, that's for our non-crisis. You're having a tough day personally or professionally. Of course, if somebody is experiencing a crisis, there's 988. There's 911. There are other very important numbers that we make sure to get out as well. Another one of our individual emotional support programs is peer support. We have over 80 trained healthcare workers on how to provide that listening ear to colleagues. And, one of our counselors is a nurse, but we know that sometimes our nurses want to speak to other nurses, our MAs want to speak to another MAs, and same for techs. And so we have peer supporters throughout the entire organization that really can relate to that healthcare knowledge and understand what it's like to be a caregiver and to experience stress. So that's kind of our one-on-one support. And then we are also offering quite a few group opportunities. We can do support groups. This can be cumulative stress. It's been a particularly challenging time, or it can be in response to an event that happened for the team, as well as workshops and things like that. One additional program that I really like to highlight is our Schwartz Rounds. This is unique to healthcare. It's think of it as a panel event where our healthcare workers talk about the emotional impact of being a healthcare worker. So what is it like to deliver bad news to patients and to family members? Things like that. Then we do a number of system things, such as our annual survey and how teams can respond. We have a sleep coaching program. We do provide the Calm app. I know Kaiser brought that up. We do provide the Calm app for free for all of our healthcare workers. We provide chair massages. We have an application where teams can get funding to do caregiver led. So we don't tell them what team building activity, they tell us what it is they'd like to do. And talking about this multi-level wrap approach, we have an emergency assistance program. So this became particularly prominent during the wildfires in Los Angeles, but somebody has a car accident, somebody needs to move out of their apartment at a last minute notice. We do have funds set aside. We also have something called a smile cart and a smile bag to really just bring snacks and cheer. And then something that was actually the birth of this Care for the Caregiver program, but became integral is our ability to respond to emergencies such as the LA wildfires. We were doing 24/7 response to not only emotionally support our healthcare workers who were impacted by the wildfires, but also getting them hoteling and things like that. And so is there one more slide, Julie, or was that it? Perfect. Our contact information. So, and again, I think you'll get these slides, but we have a phone number as well as an email. And so if you work in our Keck Medicine health system, feel free to contact us and take advantage. All of our resources are free. Thank you.
Thanks, Dara. Thank you so much. Great resources for our hospital employees. So I'm the last speaker before we get to Q&A, and I am pleased to share a new resource that was developed by our Healthy Campus Mental Health Subcommittee. So if you're on, thank you so much for all your great work. It is a manager checklist for creating a mentally healthy team. And we've been working on this checklist for several months now and excited to share that it is now available and posted on our Mental Health Subcommittee website, as well as in the chat. Thank you, Suzanne. Our goal is to provide managers and supervisors with this checklist to be used as a tool to support their role managing teams. Managers play a critical role in creating a culture where staff feel supported, heard, valued, and empowered. It's important for managers to ensure that all team members are treated equitably in order to thrive in their respective roles. So the checklist contains suggested actions to consider incorporating into your daily, weekly, monthly, or quarterly interactions with your team. So you can take a look at the checklist, but here's a preview of some of the suggested actions. Daily actions like model healthy behaviors. Take breaks and earn vacations and delegate when you're away. Set boundaries and get adequate sleep, exercise, nutrition. Manage stress and encourage your teams to prioritize these healthy habits. Make time to make connections with colleagues. Work wisely would include things around flexibility where possible with schedules and deadlines, making sure that decisions, priorities are clear, asking open questions to learn and understand, and encourage team members to ask for clarification when needed. Build relationships. Listen more than you speak. Ask open-ended questions. Give space for individuals or team to respond to questions or decisions. And notice how your team is doing, connecting on a personal level, and looking for opportunities to collaborate, commit, and follow through. Create psychological safety. Be genuine. Ask for input. Normalize mistakes and lessons learned, and offer words of encouragement. Listen, appreciate, and recognize. For weekly actions, these could be things like checking in weekly and connecting, asking team members, how are you doing? Where can I be of most support? What obstacles are you facing and what resources do you need? Communicate priorities. What is the level of urgency for tasks? Are there things that can be deprioritized and adjusted? Discuss and adjust workloads as needed and communicate transparently. Recognize team members by celebrating small wins and connecting their impact to larger team goals, making them feel valued by asking for feedback and sharing their ideas. Normalize health and well-being. Allow your team members to attend Walk USC or other wellness events happening on campus. Remind them to take micro breaks and look for ways to create an environment that supports well-being. Incorporate mental health and well-being messages into your team meetings, practices, and systems, and encourage your team members to implement work-life boundaries, such as limiting after hours or weekend emails, being mindful of working overtime, and so forth. And then quarterly or monthly things that managers can consider doing, normalizing mental health, acknowledging the stressful times, the ebbs and flow of our work, maybe if appropriate, share a mental health topic at a meeting or a resource. Communicate or speak about the importance of mental health or arrange for a talk from our WorkWell Center. Align on team norms, revisit and adjust norms and working styles, communication styles, platforms, collectively assess strategies, and determine priorities. Also, learning more about mental health through reputable resources, inviting others to share their stories, and encouraging the use of time for mental health trainings here at work. Visit Trojan Learn, a lot of great courses on mental health related topics, or reach out to us at the Workwell Center. Fostering team learning and growth, solicit feedback, explore projects and opportunities for training and development. And then finally, what can managers and leaders do for themselves? Practice health promoting behaviors, such as implementing boundaries, being active, eating balanced meals, getting adequate rest, unplugging, hydrating, connecting socially. Participate in wellness related social connection activities on campus as time allows. Find hobbies, creative outlets that you enjoy, and also make sure that you get involved at USC so you can make a difference. So with that, we have about 9 minutes of Q&A time, and I'm going to start that with some questions that we have coming in the chat. If you have anything, feel free to put that in the chat for the panelists. Some of them are already answering questions, but the ones that have not been answered, I'm going to start with Cindy. This is for you during the TELUS portion. Can you talk about how someone can qualify or actually eligibility for TELUS and what the enrollment is like for that?
The enrollment is really your current benefit eligibility. So if you are a USC employee and you are eligible for those benefits, you are welcome to access this extended care. And it is very easy to access online. And certainly you're welcome 24/7. There is a phone number that you can call. But once you have been enrolled in your current mental health and standard mental health programs, you would be eligible for TELUS. And TELUS would be there for all of you. It's a specialized program that is actually very important for the Arcadia and Verdugo hospitals. So that's a very important resource for the employees in those work environments. So.
Thank you so much, Cindy. There's a lot of questions coming in about the Calm and Headspace apps. I wanted David and Jennifer to just speak to that. David, do you want to start first and just kind of mention where and when Calm and Headspace is offered through the entire health plan?
So as of now, there is no free, everybody can subscribe for free with Calm and Headspace. However, there's a premium version, I believe. So the EPO plan and the PPO plan do not offer that premium version. So I believe Kaiser and Keck have that free version as I see on the chat. So that's where this that's what we're standing right now.
Okay, so Calm is covered through Kaiser, and then as Dara mentioned, the Care for the Caregiver.
Yeah, and I'm happy to expand on that for Kaiser members. So for those of you who are Kaiser members, the premium version of the Calm app is available at no cost to our members who are 13 years old and older. And Headspace, the premium version, is also available to members who are 18 years old or older at no cost. And the way that you would get those apps is you would go to kp.org/selfcare apps. So that is how you would access them and download them, and the premium versions are available to our members.
Great, thank you for clarifying that, David and Jennifer. Anyone else want to add?
Just that for Keck Medicine, it's also access to the premium subscription for free.
Great. Okay, other questions? I know our speakers have answered quite a few questions already in the Q&A that you can take a look at. Is there any of the questions that maybe, I know there was a lot for Lyra that came in and a lot for our overall health plans in general. Is there anything that you want to expand on, David, Scott? I know you answered quite a bit of questions in the Q&A.
I think just from the Lyra standpoint, I know this last conversation was around Calm and what's available, but I do want to make sure that anyone that is in the Lyra Health, in the Lyra app or the has an account created, that they are aware that within that app, there are meditation soundscapes, all of those things available as well, that people can take advantage of and utilize at an unlimited resource. So if you have created your account, you could go into your Lyra library and you'll find all of those resources available to you again, as an unlimited resource.
Yeah,
Great.
as an EPO, PPO member, I would say take advantage of this. You get the 25 free sessions with Lyra, so take as much advantage before the end of the year.
Yes, and we have a ton of healthcare workers who we refer to Lyra and just such positive feedback. And think about that, the 25 sessions, it could be almost every other week. And so it's really a wonderful resource.
Great. And I know there was a question and clarification about family members under Lyra. Do you want to speak to that, David? They have to be covered by the plan, right?
Yes, so for any dependent, you need to be covered under the EPR PPO plan to access Lyra. And once they age out of 26 years old, the month after, then they are no longer covered.
Great. Any other questions, feel free to put it in the chat for us to answer or in the Q&A. We're happy to do that. Well, I'll wait a few more minutes and see if anything else comes in. Meanwhile, I know I'm getting a lot of questions just in general around how long these services are available for those impacted and leaving USC. So does anyone want to speak to that? How long is someone able to take advantage of these benefits if they're being impacted?
I mean, if we're talking about that from the Lyra side, I'm just gonna say it's typically we leave eligibility up to, let's say, USC, right? But typically we see that through the end of the month in which that impact would happen. So that's typically how we see it unless we're directed otherwise.
Yeah, once your health plans, once you leave, basically as end of the month, your insurance is terminated. So then you would have to pay out of pocket after that.
If you are an employee of USC, then after you're terminated, you have a month for our services. So if you are faculty, staff, or postdoc, you have up to a month of services with the WorkWell Center, which are free and via Zoom and in person. Of course, we do make some exceptions if we need to go past that month with flexibility, but it's typically a month that you have access to our services at WorkWell Center.
Great, thank you, Ebony. And then someone just asked when open enrollment is, and that's October 27th through November 10th. David, do you want to say anything about that so people can start preparing and thinking about that?
Yeah, so please, everybody, just pay attention to communications. There will be coming out early October. It's a lot of changes, so please read everything carefully. We know that it won't be easy for a lot of people, employees, but this is where the university is heading towards, and hopefully it's a better place. And as we change, there will be more providers to seek. So we think this as a positive.
Great, thank you so much. Well, and if there's any other questions, feel free to put in the chat, but I'll move us forward in the interest of time and appreciate everyone asking and answering questions. And yes, this recording and the slides will be available to everyone who RSVP'd or that are here today. So just a reminder about our overall comprehensive Navigating Challenging Times program. We are here to support all of you during this time. And we have this webinar series, but we also have dialogue groups, weekly dialogue groups that are happening Tuesdays at 12. And we are pleased to share that we are extending the dialogue groups to December. So please join us Tuesdays at 12. We're also offering, as we have been, our individual counseling is available, as well as leadership consults and critical incident support. So Suzanne's put the link in the chat if you want to check out and read more in detail. Our next webinar is coming up in October, and that is on coping with trauma, loss, and grief. And we're really excited to be able to present that to you with speakers from Care for the Caregiver, our WorkWell team, as well as School of Social Work. So make sure you sign up for that and the rest of the series. And a couple reminders at the end, we have our Healthy Campus Initiative. We are working together on various projects to support our faculty and staff during this time. And we're excited to have opportunities for any faculty and staff to join us to collaborate on projects related to mental health, which this webinar was a product of that mental health subcommittee, but also areas of movement, nutrition, financial wellness, social connection. The time commitment is about an hour a month. So reach out if you're interested in being part of Healthy Campus. Also, Walk USC. Right now, it's so important to prioritize our health and well-being, and we have a convenient way to do so right here on campus to connect with colleagues and move. We have over 40 walk leaders and about 25 walk sessions a week happening at HSC, UPC, Remote, Alhambra, and ATRI in San Diego. And we're going to be starting walks at USC Towers in downtown, and then 2 other locations coming soon that I will announce later. So please join us. And if you're a walk leader, you can also earn points towards the Vitality Health Assessment Program. And Eat Well, our next Eat Well Bites webinar is October 2nd on eating sustainably for our health and our planet. We also have our Eat Well meals on campus. This is in partnership with Hospitality. So when you're looking to order a meal on campus, look for the Eat Well logo in the dining app and the kiosks. Our cookbook is almost ready. We're so excited to share that our faculty and staff cookbook is going to be posted very soon on our webpage. So we'll announce that once it's ready. But right now we have videos and recipes, over 100 of them, to showcase how to make quick, easy, healthy breakfast, lunch, dinner, snack, and dessert ideas. In addition, we have guides for balanced dining on campus, how to coordinate healthy meetings and events, and eating nutritiously at Trader Joe's and at the Village. And a reminder to sign up for Eat Well Bites. It will continue to the end of June 2026. We're very excited. And you can scan a QR code to learn more and see all the topics. And then finally, stay in touch with us. You can join our listserv to receive announcements from Healthy Campus. We have 3 Slack channels, so get involved and connect with others, or just reach out to connect with us for any questions you might have on anything that we shared today. And lastly, thank you, everyone. We have an evaluation form that we would love for you to fill out. Give us feedback. It's real important to us. And you can scan the QR code, or you can access that link when we send out the slides. And also a reminder for those of you that are benefits eligible, you'll be earning your 50 Vitality points for attending today, or 35 points for viewing the recording. And we'll take care of that all for you. So thank you so much, everyone, and we really appreciate you being here. Again, the slides will be provided as well as a link to the recording. Thank you so much and have a great day. And panelists, if you can stay on, that would be great.